ImmuView is the first urinary antigen test to provide rapid and simple detection of both Streptococcus pneumoniae and Legionella. The test makes it easy and fast to detect if the patient has one or perhaps both infections. Before getting started, make sure that the urine sample is at room temperature. To use the ImmuView strip test, just follow these 3 simple steps. The first thing you have to do is add 3 drops of urine into the test tube. Then add 2 drops of running buffer into the same test tube and whirl gently, like this. Finally, add the ImmuView strip and wait for 15 minutes. Your result is now ready and must be read within 5 minutes. Gently dab off excess sample fluid and read the result. The ImmuView strip has 3 lines: a control line on the top, a Legionella line in the middle, and a line for Streptococcus pneumoniae in the bottom. This is how the test should be interpreted. A positive sample for Legionella and Streptococcus pneumoniae. For Legionella only. For Streptococcus pneumoniae only. A negative sample will only show a single purple or gray control line in the top of the test. Always remember to look very carefully if any lines appear, as a urinary specimen with low levels of antigen might give a faint line. Any visible line, even though faint, is a positive line. Please notice that the test is invalid and the sample should be retested if no control line can be seen, all the lines are the same color, or one or both of the lines are not complete. With the result of the ImmuView test, together with the clinical symptoms, you can initiate the correct treatment. Before getting started with ImmuView, remember to carefully read the labels and instructions. Make sure you always follow the directions described in the product insert. They will explain how to use ImmuView and how to interpret the result.